and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning in to Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
And Facebook. Well, welcome to another edition of Your Health Matters. I'm your host, Rehanna Ramsay, and today we have in studio with us Dr. Kwesi Grant, medical officer with the responsibility for tuberculosis and HIV within the National Tuberculosis Program at the Ministry of Health, and Dr. Jamal Duncan, medical officer with responsibility for multi-drug resistant tuberculosis at the National Tuberculosis Program at the Ministry of Health. Welcome, gentlemen, and today our discussion, for those who are now joining us, will focus on that disease and how we can protect ourselves, especially now that we're dealing with a pandemic. Welcome, Dr. Grant and Dr. Duncan. You can just introduce yourselves to our listeners and then we'll go into our discussion.
Well, thank you for having us and always extending the invitation to the National TB Program, Ministry of Health. So my name is Kwesi Grant. I was trained in Cuba and returned to Guyana, served at Georgetown Public Hospital, and served some time in the hinterland, where I worked extensively with the malaria program at the regional level. And then I headed the malaria program at the national level, Ministry of Health, for a few years, 3 years. And now I'm over at the National TB Program as TB-HIV focal point there. And it's a pleasure to be here, and thanks for having us once again.
Dr. Duncan?
Good afternoon, everyone. Similar to my colleague, it's a pleasure being here, where we can compart some basic knowledge concerning the disease, especially in this pandemic time. I've been working at the TB program for about 2 years now. Firstly, I worked in the capacity as TB in migrants, and due to staffing and so on, I'm now working at the focal person for multi-drug resistant TB.
All right. For those who are listening, tuberculosis, we will have the doctors explain to us what tuberculosis is, but it's a very it's a disease that damages your what's call it your lungs, and that can lead to further complications and even death. So a couple of years ago, I was reading up on it, and not a couple of years ago, but a while back, we were one of the highest. We had one of the highest rates of tuberculosis, but since then we've moved away from that. And so Dr. Grant will give us a bit of a rundown on our development. But before you do that, Dr. Grant, could you tell our listeners, give them like a definition of what tuberculosis really is?
Right, so in layman's terms, tuberculosis, also called TB. So whenever you hear the term TB, it's the same as tuberculosis. It's a very contagious disease. It's airborne, and it is what we say opportunistic. So it waits until our body immune system is weak, and then it attacks us. And it is spread, as we mentioned, it's airborne. So therefore, it is spread when a person coughs, sneezes, or sings. The water droplets, the bacteria form water droplets that go into the atmosphere, and depending on the environment you're in, these droplets can be suspended in the air for quite some time. So if you're in an environment that is poorly ventilated, there's no airflow, is AC, these droplets can be suspended, and a person who is not sick, who's healthy, who doesn't have the bacteria, can inhale that bacteria. It goes in, and depending on that person's immune system, they can get sick with the TB disease.
And the symptoms, you said sings. It's a respiratory disease, basically. So, could you tell us about the symptoms? Like, what do you look for when somebody has TB?
Well, first of all, I must say that we have two major types of TB disease. We have the TB disease that affects the lungs. So 85% of our cases are cases that relate to damage to the lungs. And we have another 15% of the cases are what we call extrapulmonary TB cases. These are cases that affect anywhere in our body, except our skin, or except our nails, our teeth, and our hair. So it can affect anywhere outside the lungs, your skin. It can affect our abdomen, our spine, our brain. And this is very important to note, because a person may not be coughing, but may be experiencing one of the symptoms is weight loss, loss of appetite, night sweats, but they're not coughing or coughing up blood. They might not think that they have TB disease, but they can very well have the TB disease, but not the TB disease that is affecting their lungs. So the symptoms for TB disease that affects your lungs, you would have a cough for 2 weeks or more. This cough is usually what we call productive, so you bring up cold with a cough or phlegm, and the phlegm can contain blood, not streaks of blood like whole blood or clot blood as we call it here in Guyana. And or the cough can be green or yellow, and this is accompanied by fever, night sweats, weight loss, loss of appetite. The person can have sometimes diarrhea, depending on the case. With a TB that affects the body outside the lungs, all other organs, you can have these symptoms that I mentioned, except the coughing and the coughing of the blood. But you can have the other symptoms, and once you're having those symptoms, you should also think about TB. But this TB may not be affecting your lungs; it might be affecting other parts of your body.
Similar. It looks quite similar to TB. The symptoms are quite similar. How can a person, or what should a person do if they're experiencing those symptoms? Where can they go to get tested or screened, or should they visit their doctor? What the advice for them?
Well, currently at the program, what we're doing, if we find that a person has signs and symptoms that also mimic that of COVID-19, we allow them to do a COVID-19 test first, and then when they're clear for the COVID-19 test, then we do the necessary screening and testing for tuberculosis or TB. And so, well, the main difference between the two diseases is that for COVID-19, the cough is usually a dry cough. It's not productive cough with blood inside. And you have other symptoms like loss of taste, loss of smell, which is more leaning towards COVID-19 than tuberculosis. So out of the abundance of caution, we advise persons that if you have these symptoms, that you should call the COVID-19 hotline, get your COVID-19 screening, and if when you're screened for COVID-19, they decide that they should test you, you should take your test, the COVID-19 test. And once you cleared of that, then if the symptoms persist, you should get it checked out for TB, tuberculosis. And so we're very happy for this discussion because, the talk now is COVID-19. And sometimes we're forgetting the other public health threats like malaria, like TB, like HIV and AIDS. And so we need to continue to keep the conversation on these diseases to remind persons that even if you're cleared of COVID-19 and these symptoms persist, like I mentioned, the weight loss, the coughing for more than 2 weeks with blood, the loss of appetite, the fever, if these night sweats, if these symptoms persist, you should still check with your medical provider, check with the TB clinic, and do your screening and testing.
In terms of the development of the disease, because I know most diseases, or if not all, they start with the incubation stage and then they persist. How long does it take before you start actually showing symptoms for tuberculosis?
So one of the things I mentioned is that tuberculosis is an opportunistic disease, meaning it waits until your immune system is weak. As we say in Guyana, your body is run down, and then it goes into full-blown TB. So there's a possibility that you and I, we can have the TB bacteria, but because we have strong immune system, we haven't developed a TB disease. So we have something we call latent TB infection or sleeping TB. So we have the TB bacteria, but because of our immune system, because we're eating well, because we're not malnourished, the disease does not progress the infection does not progress into disease. And so for example, for persons who are contacts of TB disease patients, we usually screen them. We do a simple test, a skin test, to see if they have the sleeping TB or latent TB. Because we don't want that the sleeping TB to progress into TB disease. And this can take a few months into many years, 2 years, that it can progress from infection to TB disease. So it's very important that we ensure that our immune system is up and running, that we're eating healthy, we're exercising, that we're taking our rest, that we're hydrated, that we watch our what we call in medicine body mass index, that we are not malnourished, and that we're not using any drugs, misusing any drugs that can make us vulnerable. For those who are in overcrowded spaces, those shut-ins, those in prisons, those living in homes, they also have to be careful. For persons who have underlying disease, such as persons living with HIV and AIDS, persons with diabetes, persons who are on steroids, corticosteroids for a long time, like prednisolone, they should watch out, because these things can make one's immune system weak, and so the infection can progress into a disease. And as I said, it can take a few months, up to 2 years or so. So, we're cautioning these what we call vulnerable groups or risk groups for the TB disease.
What types of screening? I know they're screening. But what types of tests do we have available in Guyana for persons who might have that disease?
So we start with the simple test for the sleeping TB or the latent TB. So we have the tuberculin skin test or the Mantoux test that we do. So it's just a test to determine if you have the bacteria, but you don't have the disease, full-blown TB. And once that's positive, we put you on what we call prophylactic treatment, TB preventative treatment, and the number of months for that treatment depends on if a person is HIV positive or HIV negative. And then we have what we call the gene expert test or the sputum test. So a person would have to cough in a sterile container. So we have to receive the first phlegm from that person's lungs early in the morning, before they eat anything, even before they drink anything. we try to get that forced phlegm from their lungs, so they have to inhale very deeply and cough into a sterile container. And when that person does that, that is taken and we do a specialized test called gene expert test. Or in some cases where we don't have gene expert in those remote areas, we can do microscopy tests. We can look to see if the bacteria is in that sample under microscope. So those are the tests, and we also have culture. You know that bacteria can grow, unlike viruses. It can grow outside the body. So that's why we always have to be sterilizing our tabletops and so on, because it can have bacteria growing once the conditions are favorable. And so we can grow the bacteria, and when we do that, we call that a culture. So we can collect a sample from the person, a sputum sample, and then create the right conditions for that sample to grow, and we call that a culture. So those are the main tests currently at the public health facilities that we are doing.
So for those who are joining us on Facebook, you were encouraged to send your questions, any question you have about the disease, because we're talking about tuberculosis and how we can protect ourselves, especially during the pandemic. Tuberculosis, for those who don't know, is a respiratory illness, and it can lead to serious complications with your organs, particularly your lungs, and that can lead to further complications and even death. So it's very important that you protect yourself against any infection, any types of viral infection at this time. We'll go a bit over to Dr. Duncan, who's been sitting in the corner quietly listening and nodding his head. And we're going to ask Dr. Duncan to give us a little bit of differentiation, because you would have mentioned that there are different types or would use what we would call spectrums of the disease. There's a different scale. So you can just explain, if you could just explain for our listeners the difference between tuberculosis, a tuberculosis infection, and a tuberculosis disease, and how the two.
Just as my colleague said, latent TB or sleeping TB is when the person is exposed to the bacteria. However, due to the immune system being, up there, it's working, the bacteria per se is placed, is made dormant, made asleep. So the bacteria is found in the lungs there, but it's asleep. It's not doing anything. Individuals with latent TB, due to this, the TB it cannot be spread because it's not active. The bacteria is not growing. It's just left in one place. So these persons cannot spread the disease. They do not have any symptoms, right? And as Doc would have said, if their immune system remains okay, they can go through the rest of their life and they never develop what we call active TB disease, or the ones where they have the symptoms. It's true research has shown that 10% of persons that would have had latent TB will later on in life, as Doc said, within 2 years can develop what we call the active disease. Now, the active disease is where the bacteria is not dormant, it's not sleeping. They're allowed to proliferate and they're allowed to grow, and they break the immune system, and they're able to spread to other parts of the body. They can either stay in the lung, where we have TB of the lung, or as Doc said, 15% can go to other parts of the body, with the exception of the hair, the teeth, and the nails. So we can have TB, as Doc said, of the spine, we can have TB of the brains, TB of the lymph nodes, which is the most frequent form of the extrapulmonary disease. We can also have TB of the abdomen. I've had cases where you have TB of the breast, TB of the testicles, or testicular TB. So wherever the bacteria can go, they will go, and they will cause the disease. So active TB disease, individuals that have this form of the bacteria, they are infectious. They can spread the disease to those that are close by through the respiratory tract, or through coughing, as Doc would have said, sneezing and singing. Anything that can get the phlegm out of the lung and get it to expel, those are means that it can be spread. So these persons can spread the disease, active TB. These persons have the symptoms, and if not treated, these persons can move from what we call drug-sensitive TB to what we call drug-resistant TB, which we'll talk about later. So you have,
Coming to that.
yeah, we'll come
And I
to.
know that's your area.
Yeah, that's my area. Right. So we have the latent form where the TB is dormant, the bacteria is dormant. These persons are not infectious, they can't spread the disease. They can go through their whole life never knowing that they have. Many times we diagnose these individuals through just random tests. They come maybe for work, work related. Um, they might need a food handling certificate or something, just to show they might be traveling to other country and need these tests to be done. Many times, these persons are diagnosed through this means. Whereas you have the active TB, which can spread, which is the one that we're more accustomed to. These persons, they have loss of weight, they have their cough, they have fever, loss of appetite. So these are the different forms that we've had.
We'll go to a short break in a few, but before we go to break, there was a concern as to how common is a TB diagnosis among Guyanese, because I mean many people might not want to come in for a test or don't feel the need, and they might have it lying dormant, and then until they have to travel or something like Dr. Duncan would have mentioned, then it shows up. So how common, can you speak to that, how common it is among us here in Guyana?
Well, our new cases, or we say incidence of TB, has been decreasing gradually in Guyana. I know when you shared some stats when we were communicating, you were saying that we had approximately 180 per 100,000 incidents. That was in 2004. But more recently, for example, in 2018, we had 66.8 per 100,000, and 2019, 66.8. So in 2018, 68.8, and 2019, 66.8. So you see there's a gradual decrease, and that's a big decrease from 2004, where we had over 100 per 100,000 as the incidence. And so TB has been gradually on the decline. And because of that, persons can become a little complacent because they're saying, oh, I don't think TB is a public health threat anymore. And so that's why we're having these discussions and these conversations to remind them that it's still prevalent. I think one of the reasons why we had this decrease over the years, we moved from a central point of diagnosis and treatment of our TB cases, and now we have a decentralized sites. So we have 20 sites doing TB diagnostic and treatment services across Guyana, across all administrative regions. And our most recent site was commissioned in Port Morant in Region 6 on March 24 this year. World TB Day, yes, World Tuberculosis Day. And so because we're taking the services to the people, when persons realize that they have these signs and symptoms, they can go. They don't have to travel. For example, someone from Madia in Region 8 doesn't have to travel to Georgetown to receive care. They can receive care right at Madia Chest Clinic. And so because of that, we can, what we call, stop the transmission, because it's very important to treat as soon as diagnosis is made, so as to stop the transmission, because we said TB is very contagious, very infectious. So the longer a person has a TB disease, they can transmit it to other persons, it can spread. And so once a person is diagnosed quickly this and treated on time, in a timely basis, this can stop the transmission rate of the bacteria.
All right, we'll go to a short break, and when we come back, for those who are joining us, you'll hear more about tuberculosis and how you can stop the spread and how you can protect yourself. Welcome back to the program, and you, for those joining us now, you're listening to Your Health Matters on Kaieteur Radio, and those on Facebook. We're talking about tuberculosis and what we need to know about the disease and how we can protect ourselves during the pandemic. We have with us Dr. Kaieteur Grant and Dr. Jamal Duncan, both doctors attached to the National Tuberculosis Program of the Ministry of Health, and they're sharing with us some insight on how we can basically protect ourselves. So before we left, we had a bit of information about how the disease spreads, what it is, and all of that. So right now we're going to ask Dr. Grant to tell us about tuberculosis and HIV, because there seems to be a common link between the two. So Dr. Grant, could you tell us why there is that link, and how persons with HIV could probably protect themselves?
Yes, so thanks for having us back again. So, as I mentioned earlier, tuberculosis is an opportunistic disease. It waits until one's immune system is weak and then it attacks full blown. And so, one of the ways in which our immune system can be weakened is through infection and rapid replication of the HIV microorganism. So, for persons living with HIV, they can develop TB if they are not on their treatment, if they're not visiting their medical practitioners or physicians often, and not getting that care that they need to ensure that the virus is not what we call replicating. And so we advise persons living with HIV, persons who know their status, and once you have a positive HIV, that you seek care as soon as possible, because what can happen is that that person can be infected with the TB bacteria, and it can move from TB infection to full-blown disease because the virus is weakening the immune system. Another thing to note is that for those persons living with HIV, when they come for care and treatment, what we do once we clear them for active TB or TB disease, that's through a sputum. We also do a chest X-ray. So a chest X-ray is another, not a test, it's a screening tool that we use to check to see the lungs. And once that person is cleared of TB from viewing the chest X-ray and from doing the sputum test, where the person would cough in the sterile container, we start them on TB preventative treatment. So for persons living with HIV, we're being very aggressive in how we manage these patients, so that if perchance they have the TB bacteria, if they have the TB infection, this will decrease its chance of developing or progressing into TB disease. And persons who are persons with tuberculosis, they can become infected with HIV along the way. And the TB disease, once is not treated on time, can cause more rapid replication of the HIV virus. So that's another link between the two diseases.
We would have talked about COVID-19 previously, and in terms of COVID-19 and how you treat tuberculosis, there's similar recommendations because of the resemblance of what happens when you contract both infection. You're infected with both diseases. Could you speak to that? Some of the ways that people with tuberculosis protect themselves, as well as those with COVID-19, because you would have mentioned that there's a similarity with that.
Yes, there's a similarity. They're both respiratory disease. They can differ slightly in the way they are spread. COVID-19 is more contact spread, mostly by contact. So the droplets can fall on surfaces and stay in surfaces for a long while. And once we touch the surfaces with the microorganism or the virus, it can be transmitted to healthy persons. While for TB, it's droplets. So the droplets are usually in the air for quite a while and it's inhaled by healthy persons who are not sick. But because they're both respiratory illnesses, they have similar ways in which we can prevent or stop the spread. And of course, wearing a face mask is one of those ways. And so don't be sad that we have to be wearing face masks in public. I know persons interacting with persons, they're saying sometimes they don't like wearing a face mask all the time when they go out into the public, and they feel like they're breathing in their own carbon dioxide, and they feel like they're stifling with a face mask. Try to have a face mask that is comfortable, that's covering completely your nose, your mouth, and it's supposed to hang or be snugly under your chin to ensure maximum protection. And so wear your face mask whenever you're in public, and that's the way. Especially in areas where there's poor ventilation, in AC areas, in AC environments, you ensure that you have on your face mask. That's one of the recommendations where there's not proper airflow and there is no proper ventilation. Of course, the other measures applies. For example, we ask person to practice proper cough etiquette. So we should, as Guyanese, please, because I see it about, we spit in the street. As we say, sometimes I like to talk sometimes our local parlance. We hawk and we spit in the street. We can't be doing that as Guyanese at this time. So we're not only fighting against COVID-19 when we don't do that, but also tuberculosis. Let's cough covering our mouth, and we cover our mouth either in the fold of our elbow if we don't have a handkerchief. But if we have a handkerchief, we cough into the handkerchief or cough in a paper towel. Never cough. One should never cough in one's hands just like that. That's not the correct way to cough. And of course, it's not correct to just to cough and to spit it out on the street. That's not. And to continue to practice good respiratory hygiene, ensure that you use supplements that support your lungs, ensure that you use your omega-3, omega-6. Those help to open up our air spaces in our lungs, and ensure that we're using our vitamins, vitamin C, using our supplements. And some person might say we can't afford those vitamins and supplements, but we have in Guyana a plethora, lots of fruits, abundance of fruits. We have our cherries, we have our pawpaw, we have our oranges, our citrus. We can go into the market and shop up and get them, whatever's in season. You buy what's in season and you use. And use your vegetables and your brown rice, and try as much to eat healthy. This will protect us not only against COVID-19, but against tuberculosis.
We have a course of treatment for tuberculosis in Guyana. Could Dr. Grant, I think you would be able to speak to that, and then we'll talk to Dr. Duncan about the drug resistant tuberculosis, right? So in terms of the treatment, because you talk about eating right, which is for most diseases, you want to protect yourself, you have to eat right. So in terms of our treatment, what is available for Guyanese?
Right. So because the microorganism or the bug or whatever you want to call it that causes TB is a bacteria, we use medicines that kill the bacteria, and so we use a combination of 4 medicines for the initial 2 months, and a combination of 2 medicines for the last 4 months. So typically the treatment is 6 months. It can go for more depending on the type of TB the person has, but generally it's for 6 months. And so the medicines are rifampicin, the medicines are isoniazid, rifampicin, isoniazid, pyrazidamide, and ethambutol. Those are the four. So we use a combination of those four in the first 2 months, and then we continue in the last. Once the person is not infectious, Doc spoke about the person being in a phase where it can be infectious, meaning that the disease can pass from that person with the TB disease to persons who are healthy. And once we confirm through our tests available that the person is not infectious, they will switch to the two-drug combination, which is rifampicin and isoniazid for the remainder 4 months, or the number of months depending on the type of TB the person has. We should add, because these drugs can cause, they're very strong drugs because we want to kill the bacteria. And so it can cause distortions or changes to our liver. So we do regular liver function tests during the course of the treatment. Or it can cause what we call peripheral neuropathy, cause our nerve endings to be damaged in our fingers and our toes. And because of that, we give a vitamin B6, as a prevention against those. But I know, persons who are diagnosed with TB, they complain about the number of tablets that they have to take at times. We want to encourage you that please, I know it's not easy, but try to take it so that you won't fall into a relapse or get TB again, and then you might develop a worse form of the TB, multi-drug resistant TB. And so once one with TB disease takes the treatment and comply, they will be well off. And we even help them because we have outreach workers who their job is to go and ensure person take the TB medications or medicines. Because it's very contagious, we don't trust persons alone to take the medications, because they might have the medication in a cupboard or in a pill box and forget to take it today, and remember till 2 days after, or feeling better and stop taking the medicine. And we don't want that.
I was just about to say that because, as you would see, people, once you feel better, you say, oh, this is done with. But for TB especially, you have to take the full course.
Right.
Because if you don't, there are serious repercussions.
Right.
Dr. Duncan, there's an area that you are focused on, and that's the drug-resistant type of tuberculosis. Could you explain what that is and how persons can end up with that, and how they can, give us the full rundown?
Okay, well, firstly, the term drug-resistant TB, it's an umbrella term. It's a big term that encompasses many different facets. Drug-resistant TB is when the individual is resistant to at least one of the 4 drugs, which Doc would have talked about, along with other drugs that we would use if they're resistant. So, as Doc said, the 4 major drugs that we use, we have the isoniazid, rifampicin, pyrazidamide, and ethambutol. Once a person is drug resistant, they can be drug resistant to one of these drugs, or they can be drug resistant to more than one of these drugs. Drug resistant TB, like any antimicrobial resistance, is both a global threat as well as a health security threat. It's a global crisis. It's something that if it's not fixed or not, if we don't get on top of it, it can cause serious repercussions in the later, the ending. So Doc said bugs, right? TB, we know it's caused by a bacteria. But when these bacteria become resistant to what we're giving them, we call them superbugs, because what we have is not working for them. So drug-resistant TB is something that the program we're very concerned with, and since the program has been developed, we've been aiming towards trying to eradicate or eliminate this threat. Drug-resistant TB there can be different types. It can either be mono-resistant, where it's just resistant to one drug, or it can be multi-drug resistant, where they're resistant to more than one drug. Ideally, rifampicin and isoniazid. Globally, for example, in 2018, more than 500,000 persons in the world had drug-resistant TB, right? The treatment for drug-resistant TB is not the same as normal TB. It's not using just the 4 drugs and you're going to feel better. Some people say that using TB drugs for 6 months, that's long. But I have a surprise for you. For drug-resistant TB, the treatment can go for 2 years. Right? And it's not only 4 drugs. Sometimes it can encompass up to 7 to 8 different types of drugs. with one of them being an injection. So at the program, we're very adamant. We're very, with our patients, we're very, I don't want to say aggressive, but we try to make sure that once we start our patients on their normal TB treatment, we try to get them to complete it. Because if they're going to have difficulty taking treatment for 6 months, when we have to tell them that they have to take treatment for 2 years, how difficult will that be?
And it's quite a lot of pills.
Yes.
Like you said, four types of probably tablets.
The current regimen that we're using incorporates the use of an injection for 6 to 8 months, along with about 6 to 7 different types of pills. Right, and each pill there's a certain amount, because according to the individual's weight, that's the amount of pills that you're going to give them. For example, a person that has 60 kilograms may need to take at least 11 to 12 tablets at one time, along with their injection. The reason why it has to be so strong is because the bacteria, it's a superbug. We can't just say that we're going to give it this amount of pills and it's going to go over just like that. No. The TB bacteria, it's a bacteria that its genes, it mutates quickly. If you don't properly use the treatment for the first setting, you're at risk that when the person comes back again, they can develop a different form of resistance. That's why the resistant can either be multi-drug resistant, and then we have something that is called extreme drug resistant TB. In multi-drug resistant TB, they're resistant to rifampicin, where rifampicin is one of the major resistance. In extreme drug resistant TB, they're resistant to the treatment that we use for multi-drug resistant TB. So it's like a scale, it's like a step, it goes up. If you don't catch them at drug sensitive TB, they go to multi-drug. If you don't catch them at multi-drug, they can go to extreme drug resistant TB. And currently in Guyana, we do not have treatment for extreme drug resistant TB. So once a patient is at multi-drug resistant TB, all our efforts are placed to try to get this person on treatment and get this person to complete treatment. Even though it may seem daunting, 2 years of treatment, we've had many success stories. For example, in 2016, nearly all of the patients, 60% of the patients that were placed on multi-drug resistant therapy completed their treatment. So we've had great success stories. It's just that the patients, we need their cooperation in order to complete such.
You said that you don't have the treatment for a certain level, but currently in Guyana, because you specialize in this drug-resistant tuberculosis, how common is that? How often do people fall into that category?
So the cause of drug-resistant TB, it can either be through primary or secondary. Primary meaning that the person just acquired a strain. So maybe their neighbor had drug-resistant TB and they would have gotten that type of bacteria. While the secondary form is where we see a lot. The person was started on normal TB treatment and they did not complete their treatment. Right? They were supposed to go for 6 months and they ended up stopping at 2 months because they were good. They needed to work, they need to get money. So they just stopped coming to clinic or they stopped collecting the medications and they just go out there. The other forms is that sometimes, this is what we saw previously before we had the whole decentralization of the clinics. When the doctors in the interior and so on were treating the disease, we had persons using the wrong regimen. Instead of using all 4 drugs, some patients were only given 1 drug. Instead of a treatment going for 6 months, they were only given treatment for 2 months. So this would have created some of the resistance strands because the persons weren't given the adequate amount of drugs at the necessary amount of time. Right? So those are some of the major causes. Can it be because they have contracted the drug resistance strain directly, or due to maybe inappropriate drug treatment, patients not using their medication properly, they would have acquired drug resistance through that.
We have just a little bit of time more to wrap up, but there's not an actual figure as to how many persons will have.
Yes, every year we have a figure to show. For example, in 2017 we had 15 cases. 2018 there were 17 cases. 2019 there were 11 cases.
Okay,
right. So
fluctuation.
there is a bit of fluctuation, but the reason. So what we're using to diagnose multi-drug resistant TB is what Doc would have talked about before, the gene expert machine. Right. And currently, there is a plan to have a gene expert machine in all 10 regions of Guyana. So instead of just using the normal microscopy where you're going to look for the bacteria on the microscope, you're going to use this test which looks for the genetic material. It's more sensitive and specific. It helps us to diagnose not only if the person has TB, but if the person has drug-resistant TB. So, for example, in 2018, 2019, we would have done more than 4,000 of these tests. And of these 4,000, we had the 15 to the 17. So it doesn't mean that if we're increasing the amount of tests, we're going to increase the amount of cases that we see. Sometimes that's not always, that's not always the thing. It's just that what we're trying to do, we're trying to attack it at the primary level before we get to the drug resistant. We do have the regimen to treat multi-drug resistant TB. And every year, I must say that the World Health Organization, they're updating and they're changing the the regimen that we need. And we are as a program, we're on top of this. Right now we even have in stock the most current regimen, which includes the use of which includes not using injections. It's just fully oral. However, in order for us to get this on board, we need to also put in place certain other tests, which we have them. It's just that we're waiting, as time goes on to put everything on board and get it, working.
Dr. Grant, can TB be cured? Is there like a phase that you're completely, you don't have to worry about any form of relapse? Is it possible?
Yes, good question. We have a slogan that says that TB is preventable, treatable, and curable. So first, we always say in Guyana, prevention is better than cure. I grew up learning that proverb. And so we try to, through these conversations and discussions, remind persons of the measures that they can prevent getting TB. And one of the measures that I forgot to mention earlier is hand washing. Washing your hands for 15 to 20 minutes, as we say, singing a happy birthday song to yourself thoroughly. So prevention. And then by chance, if one gets the TB disease, TB sensitive disease, it can be treated. We have treatment available. And once the person starts treatment in a timely basis and completes the treatment, it can be cured. So we really work with our counseling, because it's not only giving the pills, as you mentioned, or the medicines to the patient, but we need to talk to them, to counsel, to try to quell their fears, so that they would complete their treatment. In those cases, those patients that might be suffering from malnutrition, we try to provide hampers for them as encouragement, to take a treatment. Currently, we're trying to get sanitizing package for our patients with different sanitizing agents and sanitizing items, so as to give them an encouragement to complete their treatment. Because we know that once a person completes their treatment, they can be cured of TB. They don't have to go in what we call a relapse.
And there are certain people who can't take the medication. Could you tell us about that?
Those persons who
those who fall in the category who cannot say they have TB. They have I think pregnant mothers.
Oh. I'm concerned that the tablets that are available to treat TB, they're safe in pregnancy.
Right.
Whether you're pregnant, whether you're lactating, even if you're children, it's breastfeeding. It's safe. It's safe for all.
Across the board.
Yeah, across the board. Yeah.
So you mentioned 20 sites. We have 20 locations across the country. For those who might want to know more about the treatment of tuberculosis or want to probably get treatment or get screened, could you tell our listeners and viewers where they can go to obtain that information and that service?
So in Region 1, you can go to Mabaruma Chest Clinic if you're in the Mabaruma area, or Port Kaieteur Chest Clinic. We're also in Maruka Chest Clinic, Matthews Ridge Chest Clinic, or Pakira Hospital, and at the Barometer Health Facility there. So in Region 2, you can go down to Soddy Chest Clinic in Soddy, part of the Soddy Public Hospital, and also the Charity Chest Clinic, part of the Oscar Joseph District Hospital. In Region 3, you can head on down to West Demerara Regional Hospital Chest Clinic, part of the West Demerara Regional Hospital, and the Best Hospital. Years ago, we had the TB sanatorium there, because I know when I talk to older folks, they know that persons with TB disease used to go to the Best Hospital. Now we have the clinic there. And we also have the Leonore Chest Clinic. In Region 4, we have where we see at least 50% of our cases of TB in Guyana. We have the Georgetown Chest Clinic, part of the GPHC compound, Middle Street entrance. We're right opposite the malaria clinic or the outpatient clinic. There you can come there. And we're also at Enmore Polyclinic. In Region 5, services can be sought at the Fort Wellington Chest Clinic, Fort Wellington Hospital. In Region 6, we have New Amsterdam Chest Clinic. As part of the New Amsterdam Hospital compound, we have Skeldon Chest Clinic, part of the Skeldon Hospital compound. In Region 7, we're at the Bartica Regional Hospital. We have a Bartica Chest Clinic. In Region 8, we're in Madhya Chest Clinic, and also in Parmakatoy, PK, and Kaieteur Chest Clinic. In Region 9, we're in Letem Chest Clinic and Anai Chest Clinic. And Region 10, we're part of the Family Life Health Center in the Wisma area there.
So just before we leave, the one viewer, a common, she's a regular on Facebook, Miss Sati Ramjas. She's sending in her question all the way from Canada, but I guess she's Guyanese, and she wants to know if there are any natural remedies for treating TB. If you would recommend those, can you use natural, probably bush? I don't know.
No known natural remedies for treating TB. But you can use your supplements. You can use to help to build your immune system. Any natural remedies that you can use to build your immune system, to boost your immune system, that is welcome. But to treat TB, no, we haven't come across any studies like that. So we have to take the pills, unfortunately. But we help you, we counsel you, we guide you through the process. Our outreach workers, they're very loving, caring, they're there for the patient.
And you monitor as well.
And we monitor, exactly.
You visit their homes and
Yes,
so on.
yes.
All right, so there you have it, listener, Miss Ramjas. Thank you for your question. And the doctors recommend not the natural remedies that we would use in Guyana, no bush, but you can use your natural supplements and so on to keep yourself, your immune system up. So that will bring us to the end of our program. Thank you so much for joining us, all those who tuned in on Facebook and those on the radio. Dr. Grant and Dr. Duncan were quite informative with their stuff, and so we just want us to wrap up and say goodbye to you and encourage you to stay safe and observe all the COVID-19 and tuberculosis protocol as we go through this very tough time, this pandemic. So stay safe, guys. Bye-bye.
From coast to coast,
Demerara and Essequibo,